Yeah, perfect.
Perfect. Thank you very much. So today I will give a short update on a few research projects that they have been running in the framework of our network. And I will start directly with a project that focuses on priorities for PCD research. And the reason that we were interested in this topic is that because although the knowledge about PCD increases all the time during the past few years, we still have many things unanswered, as you also realize from today's conference, and there are many things that we can improve the knowledge and the evidence. But it is important for us to really make the decisions about the priorities for future research jointly together with people who are affected and their families. And also because people with PCD may have different opinions from the doctors and the researchers on what is important. So what we aim to do was to identify priorities for PCD research from the perspective of people with PCD. And this is a study that is led at the University of Bern by me, together with the University of Southampton and representatives of PCD Support UK. So the study included two phases. One was in-depth interviews with people with PCD, adults, adolescents, and also parents of children with PCD. And as a second stage, an anonymous online survey based on the interview results. So we performed 22 interviews, trying to include patients from different age groups and also, if possible, adolescents, so that we will also get their own unique point of view. And this is a bit of a complex slide. I will try to explain it as simply as possible. These are the results of what was discussed in these interviews. So you can see that most of the topics raised as important for PCD research are around two main themes. On the right, you can see in this yellow-orange color topics that had to do with improvement of knowledge about things related to PCD. And on the left, in blue, topics that have to do with improvement of treatments related to PCD. So there were different topics where patients thought that we need to improve knowledge, including areas where we lack a lot of evidence, such as fertility, that was just discussed, quality of life and mental health, problems from the upper airways, especially hearing problems, but also improve PCD diagnosis, improve the knowledge and the education of the medical community about the disease, understand better how the genotype is linked with the symptoms and the severity, and how the disease progresses over time. Of course, very importantly, participants wanted a lot of research in finding treatments that work for PCD, from new medication that could cure or modify the disease, but also personalized treatments and clinical trials for medication and treatments that are currently already used, but we do not know how well they work. In the middle, in green, you can see topics that were related with both increasing the knowledge and treatment. So one characteristic example was how antibiotics affect the microbiome in people with PCD. What are we doing with antibiotic resistance, especially if we need prophylactic treatments, and how we can improve the knowledge and the treatments for that. So based on these results, we developed the online survey. This was available in 8 languages, and it was circulated widely through PCD support groups worldwide and through the European Lung Foundation. We had almost 400 completed valid questionnaires in the end, and most people came from France, Germany, and United States, but we had a lot of participants from many European and non-European countries sharing their opinions on PCD research. So we asked them about priorities, what I will show next, but we also asked them a lot of questions about how they get informed about research, what information they want from us, and how we can improve this communication. So this slide includes the 15 topics that they were considered as the 15 most important priorities for future PCD research by people with PCD, and they are ranked from 1 as most important to 15. So the top of this list, I will not go through all the list in detail, but you can find the slides also on the website. The top of this list had really topics that have to do with treatments, how we can find a cure, how we can choose the treatments that improve lung function, that reduce infections. Can we really find new antibiotics? It was very interesting that very high in the list also, and many of you raised this issue in the chat today, how can we get more doctors and people with PCD understand, know the disease, and involved in research? And then in lower down the list, we can see topics that I already mentioned that were raised in the interviews about mental health, life expectancy and long-term impacts, fertility, problems from the ear, the nose, and the sinuses, and go on. So what we will do with these results, we are now preparing a publication so that we can share these results with the scientific community. And we have also developed a similar study that is also completed, where we ask the opinions of doctors and researchers on what is important from their perspective. So we will compare these results. We will prepare summaries that we will share widely with all PCD support groups so they can be translated and shared with all of you in your native languages. And we will use these results as a network to try and guide our next plans for PCD research. The next study that I will present is really on one of the topics that was raised as a priority, and Johanna gave a very detailed presentation on that, about fertility, infertility among adults with PCD, but with information reported by the patient. So questions about being able to have a child or being in a higher risk of having some complications such as an ectopic pregnancy are very common, especially in adults with PCD, but even in parents of children when they were diagnosed with PCD. So this is a questionnaire study that was developed in the framework of COVID-PCD. That's an international online participatory study led by Professor Cuny at the University of Bern in collaboration with several PCD support groups worldwide. And they sent out a questionnaire that asked for self-reported information on fertility. So I will focus on the very basic overall results of the study. 118 women and 50 men replied the questionnaire, and they reported that 39% of the women and 22% of the men resulted in a spontaneous pregnancy of themselves or of their partner, which shows that even without any assisted reproduction technique, there is a number of people with PCD, depending, of course, on their genetic mutation, that could have a child naturally. In addition to these numbers, 35% of the women and 34% of the men said that they managed to achieve pregnancy with some kind of fertility treatment. So overall, from this questionnaire, we saw that a very large part of the females who participated and more than half of the men were able to have a child either naturally or with fertility treatments. This study includes many more aspects related to the frequency of ectopic pregnancies that reports that actually it is a bit higher than the overall population. And the study team is preparing the results to also share it with the scientific community, including hopefully also fertility experts, which if they are not already involved with PCD, they have a very low awareness of these problems. We are also planning to share the findings with the participants of the COVID-PCD study through a newsletter that goes to them, translated in several languages. And the study actually right now is relaunching. It was a study that started during the COVID-PCD pandemic to study the effects of COVID and other questions related to PCD. And now, since the focus is more on other questions, the study has been named as Living with PCD. So in the framework of that, we plan to study the experiences and the challenges of people on their fertility journey. So we have a lot of information through this questionnaire, specifically for how people lived this journey to fertility, to having a child, and we would like to assess that and share that with the community. The last study that I will talk about focuses on the problems from the nose, the ears, and the sinuses in people with PCD. We know that, and it was presented already, that PCD patients have many of these problems. They also have a lot of problems from the lungs, but we do not know exactly how these are connected. So what we wanted to do, we use data from BEAT-PCD. This is ENT, so focused on the upper airways, ears, nose, and sinuses, prospective international cohort study that has more than 500 patients from 10 countries and 13 centers. It's led by me in collaboration with all the teams from these centers, and it's nested in routine care. That means that participants do not need to have any extra examinations beside what you overall normally do when you go for follow-up. So I will not focus on the complex graphs. I will just explain simply what we did. We wanted to see if people who report having nasal symptoms also have more shortness of breath. And we actually saw that this was the case, not only with nasal symptoms, but also with people who reported headaches when bending down, which is a symptom that we use sometimes as a proxy for infections of the sinuses. We wanted also to see what is happening with the ears, and people who reported ear pain, especially frequent ear pain, they were also more likely to report shortness of breath. The same it was with people who reported having daily or often hearing problems. So we saw that the symptoms from the upper and the lower airways are actually associated in people with PCD of all ages. We also wanted then to see, combining reported symptoms with findings from ENT examination, if people who had chronic infections from the sinuses, so chronic rhinosinusitis, they had any association with lower respiratory symptoms like shortness of breath and sputum production. And we actually found an association also here, which is very important because still, even nowadays, in some centers, there are patients, especially adults, who are not regularly seen for their ENT problems. We then try to see for patients that had available lung function measurements if they also had an association with findings of rhinosinusitis, but there we did not find an association. This is also possible because lung function is not always affected very early on. So maybe with spirometry, we cannot capture problems with from the lower airways early on. So people had problems like shortness of breath, but did not have a very affected spirometry. So for this study also, we will publish the results soon, and we will prepare summaries that we want to share at the participants at the study centers, at the clinics, translated in their native languages. And we also plan to continue using this cohort to study and understanding better the upper airway problems in people with PCD. So that was my presentation. I would like to thank some people, especially people who participated in these studies, and collaborators from the BEAT-PCD study. Many of them are in this call, ENTs and pediatric and adult pulmonologists, and more importantly, the study participants, people who co-led with me the study on research priorities, and of course, the COVID PCD team here at the University of Bern, and most importantly, PCD support groups and the European Lung Foundation, because most of these studies have a very strong participation, not just as patients, but as people designing the research and doing the research with us. Thank you very much.